Hello, everyone. My name is Susie, and welcome to the enerjet product presentation. During this presentation, we're going to provide a short introduction about the technology and the device, explain about the enerjet technology, provide an overview, clinical evidence, treatment guidelines, competitive analysis, and supporting tools. So let's start. What is pneumatic needle-free injection? In general, we're talking about a high-pressure stream of liquid medication that is forced at a high speed into the skin, as you can see here in the illustration. The jab can travel for a long distance without dissipating throughout the way, and it penetrates the skin through a very small orifice. The enerjet is indeed a needle-free injection device. However, it has much more advantages than that. It has a minimal epidermal damage, and it creates a 3D blast of the material we are injecting, allowing the material to better integrate within the skin. We can create stronger effect than any injection, and it provides minimally invasive non-surgical procedure that produce superior, long-lasting results with minimal downtime. The procedure itself is safe, very fast, available all year round for all skin types with a minimal discomfort. So basically, we have a synergistic effect of the EBD optimal microtrauma to the tissue and the unified spread of the therapeutic material. How does the technology works? As you can see here in the illustration, and we'll repeat it again because this is very important. First of all, we have the device placed on the skin. Next, we have a very thin jet that is able to penetrate into the tissue. Once it penetrates into the tissue, this is what's happening. We have a lateral dispersion of the material. It's sprayed sideways in a 3D pattern. And basically, each part is burst into nanoparticles. Those nanoparticles can cover up to 1 cubic centimeter within the tissue, where the penetration point is only 200 microns. While those nanoparticles move throughout the tissue, they're creating this minimal trauma to the tissue that initiates wound healing cascade and eventually the fibroblast stimulation, collagen regeneration, elastin remodeling that provides us the desired long-lasting results. You can see here, this is a demonstration of an injection with dye, so you will be able to see the pattern of an acrylamide bottle gel. So we can see that once the material enters into the gel, it spreads sideways, the 3D pattern, this blast effect. We have a very high velocity jet injection of up to 150 meters per second. This is demonstrating the minimal epidermis penetration, only 200 microns. This is smaller than a 33 gauge needle. And we have a very controlled penetration depth that is up to 6 millimeter deep, and the lateral dispersion sideways up to 10 millimeters. Here you can see, this is courtesy of Dr. Tretti Clementoni from Italy. He is doing an experiment on a porcine tissue. We can see the injection of the material also dyed, so we can see the pattern of dispersion within the tissue. Once it's been injected with a scalpel, we can open the tissue and we'll see the pattern. You can see the small dot. This is the penetration, 200 microns. However, inside within the tissue, and this is the uniqueness of the device, we can see the 3D spreading pattern of the material. Let's continue to the device overview. Throughout the years since 2008, the enerjet, or formerly known as enerjet, has three major developments. So throughout the years, the companies improved the device, lowered the noise, have better GUI, and allow a better technology for superior clinical results. Until from 2016, we have the latest model of the enerjet 2.0. The device itself contains three main parts. We have the console, we have the trolley, and we have the applicator. In addition, we're using together with the device a treatment kit. This is combined of two parts. This is the single-use delivery kit that you can see here, or we can call it in short a nozzle. And in addition, we have a 10 cc syringe by BD that we are using to enable us to deliver the material that we want to inject to the tissue. We have a very intuitive user interface. We can see the proposed indication. In every step, there is an information how to continue and actually reload the syringe, remove the syringe, choose a treatment area, what the parameters are. So if your physician is maybe not remembering well the training or has some questions, the most immediate support that you can actually receive is turning on the device and start to do the treatment. Everything is placed within the GUI. The enerjet main treatment indications are as follows. We have the kinetic facelift, we have dermal thickening, that contain skin tightening and wrinkle reduction. We have scar remodeling. Within it, we have depressed scars as acne scars, hypertrophic scars and keloid, and stretch marks. And it is very important to mention that in the EU, the indications for use are acne scars and keloids. We have the freedom to choose any type of injected materials that we want to use. We can use, the most general one is the hyaluronic acid, that it can provide hydration, stimulation of collagen synthesis and bioregeneration. We usually use it for the aesthetic dermatology indications and also for depressed scars and hypertrophic scars. We can use hypertonic glucose for kinetic facelift because it provides an extra irritation of the smooth tissue. Corticosteroids are being used for keloids, same as fluorouracil. We can use lidocaine for anesthesia, botulinum toxin for hyperhidrosis, and also AJ Cellutrix for cellulite reduction. Before choosing a material, please make sure that the regulation of the material in your country is cleared. So what is the mechanism of action when using the enerjet device? First of all, we have the controlled trauma. Controlled trauma is very similar to different energy-based devices. When we're applying the device, we're actually initiating the wound healing cascade within the tissue. And we have the process of local inflammation, vasodilatation, and cell infiltration to the treatment area. And eventually, throughout a short and long period of process, we have proliferation, deposition of extracellular matrix, synthesis and remodeling of collagen and glycosaminoglycans. Here, in addition, because we're not just inflicting this very specific microtrauma to the tissue, we're also delivering material into the tissue. So we have a compression and we have mechanical stress on the fibroblasts. And because of the stress, we are initiating additional stimulation of the fibroblasts that eventually we have formation of new collagen fibers, and we have a very advanced and enhanced process of dermal thickening. In addition, on the other side, of course, we have the beneficial effect of the materials that we choose to deliver, whether it is corticosteroid that suppress the inflammation in the area, or for instance, what we see in this slide, we have the hyaluronic acid, and we have accelerated dispersion of the hyaluronic acid within the tissue, and we have additional stimulation of extracellular matrix compound. And because of the inherent characteristics of hyaluronic acid that actually absorb material, we also have a lot of moisture retention that assists us for aesthetic indications. In this part, we're going to provide all the clinical evidence that gathered throughout the years about the mechanism of action and the clinical results of the energet. In general, there are 26 published papers, 7 case reports, and 4 white papers, and they're spread throughout different categories as general science and technology, actually investigating the mechanism of action of the energet. We have scar remodeling, dermal thickening, kinetic facelift, and other indications such as hyperhidrosis. Everything is located in the company VSP. In this part, we're going to see how the energet actually distributed in the tissue, where this is the main advantage. What we can see here that the pressure that we choose for each treatment can actually determine the depth of penetration. On the left side, you can see here we have a low pressure, 30%, higher pressure, 50%, and 65%. And you can see those white bubbles are actually the position of the material injected into the tissue. Afterwards, we have histological slides that show the location. So we can see here that only the upper dermis is actually spreaded with the material. Once we elevate the pressure, we have a more uniform throughout the reticular and papillary dermis. And when we elevate more the material, we can actually penetrate to the next tissue of the hypodermis. So basically, depending on the indication that you need to treat, depending on the severity, you can actually choose the pressure, and then you will determine how the material will spread within the tissue and the results that you will receive. Here in this ultrasound, we can see the final results after 3 treatments with the energet. The initial thickness of the dermis is 1.7 millimeter, and you can see that 6 months afterwards, we are at 2.2 millimeter. So dermal thickening is indeed happening thanks to the energet treatment. The 3D fan-like spread of the material is demonstrated here. We can see here, this is an untreated tissue, and you can see here dyed injection with 6 bars, which is 100% pressure within the tissue. You can see a very uniform spread throughout the layers of the tissue. You can see here a variety of materials. This is bleomycin. You can see here with a fluorescence effect, the wide spread of the material. So this is the histological validation of the lateral dispersion of the energet. Let's look here on the left. So we can see here the dermis. We have the papillary dermis, mid-dermis, reticular dermis, deep dermis. Here we have the hypodermis. All of those White bubbles, as explained, are actually places where the nanoparticles of the material eventually spreaded. So this is the intact skin. This is a place that was not injected, here on the right and here on the left. And in the middle, the injected area. So here in the middle, you can see the homogeneous spread of the material throughout the depth of the tissue. The beautiful thing about it, that if we elevate the pressure, it does not mean that the material will spread only deeper within the tissue, but throughout the penetration of the material tissue, it spreads sideways and actually covers the entire length. In addition, we can see here blood vessels that stays intact because of, first of all, the mechanism of the nanoparticles that actually bounce from the endothelial tissue of the blood vessels. We have no pressure because of this spread. We have no bolus, same as a needle injection can actually compress vital nerve endings and blood vessels. So this contributes to low pain, low downtime, very low adverse reaction to any treatment. Those next slides actually shows the bioregeneration effect of the enerjet using hyaluronic acid. The first two slides were looking at ex vivo experiment where they've taken the tissue and aged it using UV lighting, and afterwards injecting hyaluronic acid with the enerjet. And what we can see here on the top, an elevation in a stimulation of collagen synthesis after 1 month after the treatment. On the second one, we can see an elevation with the production of glycosaminoglycans. And here, we can see a fibroblast migration and collagen synthesis 4 months after the treatment. You can see here again, different experiment that shows that when we elevate the pressure, we can penetrate deeper, but still have a very good coverage of the entire tissue. Now, this is all good and well, but what is the clinical result? So we can see here various demonstrations of acne scar, depressed scars, improvement, same as here, burn scar, dermal thickening, stretch marks, and depressed scar. This is caused by herpes. The enerjet is actually the gold standard in scar treatments. You can see here keloid treatment. We're able to level the keloid and produce a very nice clinical result. Hypertrophic scar that is leveled and the color is blended with the tissue, and very deep depressed scars. What actually happens? What is the mechanism of action when we're treating different indication? So let's start with post-acne scars or depressed scars. First and foremost, it's very important to understand that we can treat all types of acne scars, not just box scars or rolly scars, also ice picks. And what is the general principle here? That we have a destructive effect to the base of the scar, and we're able to build the collagen bottom up and actually lift the depressed part of the scar. When we have depressed scars, we usually have fibrous bands that anchoring the scar underneath, to the tissue underneath. This is why when we're using different technologies such as fractional lasers or RF, it's sometimes hard to actually improve the scar because the bottom of the scar is continuing to be anchored down. This is why a lot of the times we're using the subcision treatment when we are actually inserting a needle and cutting this fibrous bands that anchor the tissue. Here, with the enerjet, we have a combined effect. because we have a high velocity jet that can spread sideways and create this micro trauma, we're able to actually disconnect and de-anchor those fibrous bands and allow the tissue underneath to regenerate and lift the tissue upwards, leveling the scar. We can see here different clinical results. This is only after 2 treatments, and this is 1 month after 3 treatments. We can see a very nice elevation of the bottom part of the scars, creating homogeneous, smoother skin appearance. The course of the treatment is actually depending on the severity and number of the scars, but in general, we're talking between 3 to 6 sessions. We're recommending 4 weeks interval, 4 to 6 even, and the general time, again, is depending on the number of scars that we're treating, usually between 10 and up to 30 minutes. Stretch marks is a very hard to treat indication. Not a lot of treatment have been proved to provide a very good clinical result. Stretch mark basically is a scar where we have a ruptured dermis that actually has this either red or white stripes appearance. And in order to provide a very good clinical result, we need to have a regeneration of the tissue, creating new healthy tissue within the stretch mark location. And we're able to do so with the enerjet. And this is actually a remarkable result. You can see the before, and you can see after only 1 treatment that we see a continuous improvement in the appearance of the scar. As we all know, the tissue has a very long graph of collagen remodeling, and by allowing the tissue to regenerate throughout time, even with 1 treatment, we're able to produce very good clinical results. We're recommending between 1 to 4 sessions. Again, everything is dependent on the severity of the indication. This is why we evaluate each patient individually and then determine the course of the treatment. Interval every 4 weeks, and again, the time is between 10 to 30 minutes, relatively fast treatment. With regards to keloid and other hypertrophic scars, we're talking about a very dense fibrous tissue. And in order to improve the clinical results, we need to somehow break those strands and allow healthy tissue to be formed within. So what we are doing is actually inflicting microscopic traumatic channels and cavities throughout the lateral dispersion of the material. Because we have a very strong and powerful jet, the jet itself actually can break those strands. We have a jet pressure compression effect on the tissue, and then we can have a shutdown on the microvasculators within this treatment location. Because we are using, when it comes to keloids, because we're using corticosteroids or fluorouracil or other materials, we have suppression of the chronic inflammation and the fibroblast growth in order for us to actually inhibit the factor that actually caused the keloid to be formed from the first place. We have fibroblast apoptosis, inhibition of cell proliferation, and eventually we have blanching in the area, immediate local shutdown of the excessive microcirculation. We have a break of those very dense fibrotic strands and allowing new healthy collagen to be formed inside. When we are performing the treatment, of course, we will want to cover the entire size of the scar, and our endpoint are those bleaching, those white areas, and the pinpoint bleeding that we actually receive in every treatment, and you will see it when we'll discuss the treatment procedure. You can see here a keloid, small keloid on the ear, and the delivery of the material to the scar. We can see a pinpoint bleeding, we can see the bleaching, and this is what we need to look for when we're providing this treatment. We can use the enerjet also for aesthetic indications such as dermal thickening. We can see here on the slides, we have neckline, which is a very hard to treat indication. And I'm very happy to say that the enerjet can perform an amazing job treating necklines. Décolleté area as well, we see a nice tightening, lifting, regenerating effect on the tissue. For dermal thickening, we recommend between 2 to 3 sessions every 4 weeks, and again, 10 to 30 minutes each treatment, depends on the size.
This slide demonstrates the dermal thickening effect for the long term. In this study, the investigators provide treatment in different treatment areas as displayed on the bottom. Treatment areas such as periorbital, necklines, and forehead. And they measure the dermal thickness before, immediately after 3 treatments, and 6 months after the last treatment. The results are amazing because not only that we see a very good improvement, immediately after 3 months, we can see the difference between the gray bar and the light blue bar, very good improvement in all treatment area. It's the fact that 6 months after the 3rd treatment, either the result remained or even continued to improve. It comes to show us that our body's physiology, the effect that we inflicted to our tissue, continues to work, continues to improve with time.
Additional indication is kinetic facelift and skin tightening. What the procedure itself is actually injecting the material throughout the patient hairline, creating a lift of the entire facial feature. And we can see here we have an eyebrow lift, we have more exposure of the eyelid, and we have a V-shaped effect to the lower part of the face. Additional indication that is now being evaluated is a palmar and axillary hyperhidrosis. Dr. Ophir Artzi published a paper that actually checked the effect of injecting botulinum toxin to either the palms of the hand or the axilla, and checking the effect 1 month later after only 1 treatment. And we can see that we have a very good improvement in both the dye test and in the disease severity scale only after 1 enerjet treatment. Let's continue to the treatment guidelines. What are we doing before the treatment? First of all, of course, we have the enrollment meeting where we are reviewing the patient's medical history. We're using the contraindication list that we will review in a second. We have the patient sign the informed consent form. We need to explain to them what is going to happen throughout the treatment, and that they need to report any change in their medical condition, explain all the side effects that are potential within the treatment that we choose, And then we review with them what is the treatment procedure. What are the parameters that we're going to use? What is the number of treatments, the interval, and the post-treatment guidelines? Those are the contraindication for the enerjet treatment. Those are basically similar to contraindication for other EBD devices. However, we have less contraindications because this is not thermal or light-based energy. Therefore, we have fewer risks. This is the full list of the possible side effects. It needs to be stated, and you will see it in related papers, that the frequency of side effects is very, very low. First of all, we have light pain or sensitivity in the injected area. It is a given because we do penetrate the epidermis. We have nodule formation in the injected area. Those are the papules that actually represent the material that's being injected into the tissue. And we have erythema and or edema, the swelling, and this is because we are creating a controlled local inflammation within the treated area. In addition, we can have some itching or irritation in the treated area. Usually it is due to overlapping between shots, so this is something that we can overcome with practice and making sure that we're working according to the protocol. Hematomas is also a possible side effect, and we can use it by actually adjusting the pressure to the treated area. If we have a thin skin, of course, we will not use a very high pressure. So this comes with experience and with the guidelines. Allergic reaction can occur in the injected area due to the material. So this is something we can cover within the contraindication and when we're doing test procedure. Infection. Usually it can happen if we don't keep the place clean. And this is guidelines that we provide to the patient in the end of the treatment. Please do not touch the treated area. Usually they like to examine it with their fingertips. So it's very important to keep the place clean, sanitize, use antiseptic cream after the treatment that will prevent any types of infections. PIH, it's a possible side effect, and usually they occur with people with a predisposition of PIH, such as Fitzpatrick skin type 4, 5, and 6. So we're doing the enrollment meeting, we're reviewing the previous procedure and any interventions that the patient may have went through, determine what is the treatment, what are the expected treatment results. Of course, we need to set very realistic expectations. If patients come to a consultation and with a very severe scarring, the scar will never be disappeared. The wrinkles will never be disappeared. We're not going to provide a clean slate. We're going to provide a very good improvement. And this is very important to express that and let them know what are the expected results. We need to have a very accurate diagnosis and perform test procedure. It's very advised, that way we will know there's no allergic reaction and we're actually easing the patient into the treatment. We need to keep in mind that the enerjet is a very unique device. Most probably they've never encountered this device before, seeing this physician, seeing the treatment and experiencing the effect of the treatment. When we're doing this test procedure, we're easing them into the treatment, we're elevating the confidence with the physician and the treatment itself, and making the treatment itself very clean and smooth sail. So what is the treatment procedure itself? Let's take it step by step. The first step is actually preparing the materials that we are going to use. In this case, we're going to demonstrate how to dilute hyaluronic acid. It's very important to understand that when we're using hyaluronic acid, we're not actually using it with the same indication for use of the injectable itself. It is not a filler. We are using it in order to have the nanoparticles that will create the microtrauma, the lateral dispersion within the tissue, and it will allow us an actual benefit of the moisture retention and the compression on the fibroblasts. So we're taking a 10 cc syringe, and we are using saline in order to dilute the chosen material, whether it is hyaluronic acid, corticosteroids, or something else. We're loading the hyaluronic acid filler syringe, and using a stopcock, we're delivering the materials into the syringe containing the saline. After that, we're mixing. This is a very important step. You can see here we're actually transferring the material from one side to the other. We're doing the mixing very, very gently in order to prevent the penetration of air bubbles into the solution. It is very important because if we have small air bubble, then the jet integrity, once it leaves the nozzle, it will be compromised. The next step is to avoid air microbubbles. And how do we do that? After we mix, we will hold the syringe in this figure. We will hold the bottom syringe and pull the plunger from the upper syringe, that way allowing all the air bubble to leave the solution. Once we finish to remove all the air bubble, we have the final formulation. We'll make sure that we are removing any remaining air in the syringe. And now we will turn to the enerjet in order to place the syringe and the treatment kit on the device. So the applicator has a chamber. We can open the side door in order to see this chamber. Following that, we are placing the syringe through the opening and insert the syringe barrel flange in the slit. We are inserting the nozzle here on the applicator slot, and we are attaching the silicone tube to the syringe. And now the system is good to go. So once we place the syringe and the nozzle in place and pressing confirm on the system, we have the pusher going forward until it meets the plunger of the syringe. The pusher is the one that actually is in charge to deliver what we are placing into the system with regards to the volume. If we're choosing 100 microliter volume per injection, the pusher will push the plunger each time in the exact amount chosen for the treatment. The next step is adjusting the treatment parameters. Actually, the enerjet device is very simple because we only have two parameters that we have to choose. The first one is the pressure, as you can see here. The pressure determines the depth of the penetration. and we can choose it from 0 up to 100%. And the second one is the filling level. We can choose between 50 microliter up to 100 microliter, 150 microliter. This is with a 10 microliter increments. Once those parameters have been chosen, we're going to push the start button and we're able to start the treatment. Throughout the treatment, we will probably have to adjust the jet pressure. This is the actual endpoint that we are looking for. The endpoint, the optimal endpoint, is about 8 to 10 millimeter circular bump or papule, and it has a height of about 2 to 3 millimeter. This actually indicates that the material was able to penetrate into the tissue, and by this penetration, the tissue elevates up. In the center, you're able to see a pinpoint bleeding, which represents the penetration point of the material. So, the optimal, as we said, is of course have this papule, have an entry point, and the residual volume, meaning the amount of material spillage on the skin surface, is very, very small. If my jet pressure is too low, first of all, it means that either there's no penetration of, or a very small portion of the liquid is able to penetrate inside, meaning that I have either no papule or a very small papule, no entry point if it does not penetrate, and of course, because most of the material does not penetrate, all of it remains on the tissue surface, so we have very excessive residual volume. On the other hand, if my jet pressure is too high, meaning I have penetrated too deep and I'm not in the location that I want to be, meaning that my papule either does not exist or very, very small because the liquid is too deep within the tissue, it does not elevate it in the optimal way. I do have an entry point because I've penetrated into the tissue, and the residual volume, again, is small. Most of the material was able to penetrate. So according to the desired endpoints of the treatment, and of course, the indication that we are treating, we're able to adjust the parameters accordingly. And it is worth mentioning that throughout the treatment, when we're moving from location to location, perhaps small adjustments are in place. So keep a very close look on the endpoint and adjust it where needed. So you can see here, how does it look? For instance, in this case, for the dermal thickening of the lower to mid face, we can see those 1 centimeter round papule with a pinpoint bleeding, and we have this erythema because we have a vasodilatation of the local trauma that we caused, and here we can see it as well when we are treating the necklines. With regards to downtime, actually the downtime of the enerjet is very, very minor, and it's very beautiful to actually see how the skin regenerates quite fast. So this is the before picture. We can see a chick with a very lax skin, and immediately after, we can see that actually most of the papules already subsided, although we can still see those round location and a pinpoint bleeding. 1 day after, because we have those small entry points, they are in this appearance, scabbed, small points. After 4 days, most of them have peeled off and we do not see any trace of it. 6 days, everything is the same, and we actually can see a very nice start of skin improvement, lifting effect, tightening effect. When the treatment has ended, we can either press pause or end treatment, And then we have a very precise instructions on how to remove the kit. We're opening the chamber. We're disconnecting the syringe tube from the nozzle. We are removing the syringe and the nozzle from their place on the applicator. And we're closing the syringe chamber. That easy. Once we press confirm, we will receive the next step, which is the cleaning. This is part of the maintenance of the device and of the applicator. We need to clean it after each treatment. This is very important. So we're using 70% alcohol to wipe all of the parts of the applicator, including pressing the trigger where a rod will emerge outside, and we need to clean it as well. Pay close attention to the instructions. Everything is listed on the GUI. You can see here that once we have pressed the trigger, this metal rod is available for us to clean it, either with a brush or with a cloth with 70% alcohol. Afterwards, we need to dry the area with a gauze or cotton swab. Once we finish to clean the applicator, we press confirm and the rod will return to its place. At the end of the treatment, we need to actually determine whether we want to shut down the system if we have no more patients, or we can continue to another session. After the treatment, we have the post-treatment care. Immediately after, we will clean the treatment area with sterile normal saline or antibacterial soap. First of all, to remove any blood residues that may be placed there because of the pinpoint bleeding, and to keep aseptic conditions to the treatment area. We ask the patients that in the first 24 hours after the treatment, first of all, keep the place clean. Don't scratch, don't touch. Don't worry, those scabs will fall off by themselves. If possible, keep it moisturized. Avoid drying because it will allow faster healing of the scabs. Don't apply makeup on the first 24 hours. Avoid any hot baths or very excessive exercising that involves sweating, because we want to keep the treatment area clean. In case of any bruising, they will usually self-resolve spontaneously. But if you want to assist or something is uncomfortable, we can use ice packs for 15 minutes every 3 hours for the first 48 hours, or we can apply any topical cream that allows better healing of the bruises, like arnica, aloe vera, or other reducing signs ingredients. With regards to the device maintenance, first of all, we need to discard the treatment kit, and we need to clean all the external part of the applicator, as we said, and also of the system. We need to shut down the system, make sure the compressor is not noisy. It means that all the air is left the system. We can make sure it's disconnected and keep the equipment sanitized, clean the screen gently with a cloth, because usually we touch the screen, so it's also a very important location to clean. A lot of times we're being asked about, okay, so the enerjet, is it like fractional laser? Is it like RF microneedling? Is it like a filler injection? Now, to be honest, it is very hard to have a competitive analysis to the device because of its uniqueness. Doctors usually, when they explain it to their patients, they're saying specifically, it's like comparing apples to oranges. It's a completely new category of its own. So what we're going to do throughout this competitive analysis is actually try to have a very shallow comparison to the mechanism of action or to the treatment of similar indications, and provide clarity about the numerous advantages that the enerjet can actually provide in comparison to other treatment modalities. So let's start with the dermal jet. The dermal jet is actually a needle-free jet injector, very similar to the enerjet. However, this is only the way of penetrating the material into the tissue. The dermal jet does not laterally disperse within the tissue, does not cause the local microtrauma, the nanoparticle dispersion, the remodeling of the tissue through the synthesis of new collagen and new elastic fibers. This is the main difference. We are injecting without a needle and material into the tissue, and this is the basic thing that is similar between those two devices. With regards to the penetration depth, enerjet, of course, can reach up to 6 millimeters, the dermal jet up to 4 to 5. With both, we have a minimal discomfort because we are breaching the epidermis and we are injecting material inside. Similar downtime, slightly irritation, swollen, red, very similar to the enerjet. We need to keep in mind that for the facelift, there's actually no downtime because we are doing the treatment on the hairline. Acne scars, especially if they are quite severe and have a high number of scars on the tissue, then it will take a little bit longer, 2 to 4 days. Side effects, as we said, redness, potential bruising, swelling, very similar. Enerjet versus needle. So it is important, as said throughout this lecture, that the enerjet is not a filler, right? We're not using hyaluronic acid as a filler. We're not providing corticosteroids to the scar as a needle injection. We're actually can combine a few advantages into one. We can see here with this illustration the very fundamental difference between needle and enerjet. So when a needle, first of all, is penetrating into the tissue, it depends on the gauge of the needle to know the effect on the breach of the epidermis. And when we are pushing the material inside, we get a very small bolus, concentrated material placed within the tissue. So the actual integration with the tissue is quite small because it's only the perimeter of this bolus. When we're looking at the enerjet and we're seeing this blast effect, and we have a very uniform dispersion of the material, and we can see it here in this very nice demonstration in the acrylamide gel. This actually shows very high tissue integration of the material. We can have a better impact, higher coverage, and better clinical result eventually. Of course, with regards to the downtime and potential adverse events, the enerjet is very, very safe, minimal side effects, almost no adverse effects reporting. So it's very important to also illustrate that. This is due to subcision. We said about the subcision effect that we can inflict when it comes to scarring. We don't have this effect. We have the pinpoint bleeding and the papule that resolves in a few hours. CO2 laser. Why we're comparing to CO2 laser? CO2 laser is a technology that most of the patients, they already know. It's out in the market, and it's something that we can compare it to, because eventually we can treat very similar indications with CO2 laser and with the enerjet. But the basic mechanism of action is completely different, because with CO2 laser, whether it is ablative or fractional, we're actually working from top to bottom, and with the enerjet, we're working from the bottom up. We have with the enerjet the integration of additional material, and with the laser, we only have the thermal effect on the tissue. With regards to pain, of course, there is a very fundamental difference. With the enerjet, it's very tolerable pain. Of course, we can use, in order to ease the sensation with patients, we can use numbing cream like EMLA, and actually provide a very better, or let's call it comfortable environment for the patient. But most of the patients do not need EMLA because the treatment is so fast and they can tolerate the pain that it's not needed. With CO2 laser, it's very painful. You need anesthesia. Also with fractional laser, a lot of time they're using topical anesthesia cream in order to ease the sensation on the patient. The downtime, as we said, it's more severe with the CO2 laser. When we're talking about ablative, it's months. And with fractional, between 7 to 40 days. It's a lot of time in comparison to the enerjet. And of course, we have a lot more side effects that are involved with this procedure as compared to the enerjet. The penetration depth, enerjet up to 6 millimeter, we can choose. And CO2 laser, it's between ablative laser 10 to 200 microns, and the fractional laser between 600 to 1,500 microns, so shallower. With regards to the number of treatment, ablative laser usually requires only one treatment, and a fractional 2 to 3 treatment, very similar to the enerjet. The duration is longer with the laser as compared to the enerjet. It's actually can be even 10-minute treatment if it's a very small treatment area. With the laser, there are no instant results. With the enerjet, we can actually see with a facelift immediate result of the facelifting and skin tightening. And with acne scars and rejuvenation, it is noticeable a few days after the treatment. And of course, with time, as we saw in the beautiful graphs, we can see improvement and keeps improving even after we're done with the treatment session. Long-term result can last up to 1 year with the laser and up to 18 months with the enerjet. Limitation: with the laser, we cannot treat depressed scars, or we have serious risks and complications. And the limitations with the enerjet, we cannot really treat the patient with excessively loose skin, and we cannot treat deep wrinkles. This table actually provides a very elaborated comparison of different technologies. We can see non-ablative lasers, ablative lasers, IPLs, radio frequency, fractional RF, microneedling RF, ultrasound, and microneedling. As you can see, with regards to treated indications, enerjet provides a wide variety. You have the freedom to choose which type of indication you would like to treat, whether it is aesthetic, for skin remodeling, for wrinkles, for facelift, whether it is scars, all types of scar, atrophic scar, hypertrophic, keloids, stretch marks. So you can pick and choose using the enerjet a variety of indication, of course, according to your local regulatory mark. With regards to the treatment area and skin type, enerjet has the advantage that because it's not an energy-based device, we can use all skin types, all year long, all locations. We do not have any restrictions, and it makes it a wonderful tool to address different needs. Penetration depth can go up to 6 millimeter. It's one of the deepest penetrating device on the market. The downtime in comparison is very, very short. Pain level on a VAS score, you can see that the pain level is actually 2, which is considered very, very low. I think that only the non-invasive RF or microneedling is in a close proximity to this grade. Side effects, also very, very low frequency of side effects. And the dermal thickening effect can be up to 200 or 250% of improvement. This is very high in comparison to all other technologies and treatment types. We can see here comparative data of the post-treatment downtime. You can see here below the different technologies. And we have, according to type, erythema, edema, spot bleeding, and scabs. So you can see the number of days here on a graph, and the enerjet is quite low in comparison to non-ablative lasers, ablative lasers, fractional RF, and fractional RF needles. The pain level, you can see here, same, only 2 on the VAS score. And this is without numbing cream, without anything. This is why we can offer this option, but usually it is not really needed. Number of side effects, very, very low in comparison to other technologies. Ablative or fractional lasers, 7, only 2 with the enerjet. So to summarize all the information we have reviewed during this presentation, let's see all the advantages that the enerjet has to offer. So we're talking about, first of all, a lot of advantages. We have safe treatment for all skin types. It doesn't matter if you have a very high Fitzpatrick skin type or Asian skin with tendency to PIH. We can treat all skin types. We don't have any burns as a side effect as other technologies because this is not a light or a thermal-based device. We can use it all year long, summertime, when you are tanned, no problem. We can penetrate very deep into the dermis. And when we're penetrating deep, we still cover the entire length of the tissue. Very homogeneously, we spread the material, and the material as our nanoparticle affect the tissue and initiate the regeneration of the tissue and production of the ECM products that we need. We are creating a very controlled microtrauma. Only in the injected location we can pinpoint it through the pressure that we are using and the volume of the material in order to make it in the right location to yield the very superior clinical results we're aiming for. No needles. There is a high percentage of population that has a needle phobia, especially when we're treating keloids, which is, first of all, the gold standard is corticosteroids injection with needle, and the place is usually painful, tender to the touch. When we are introducing no needle option, patients love it, and they are welcoming the treatment, and they receive at the end a very good result. We have a substantially reduced pain level, only 2 on the VAS score. The device itself is very simple. The GUI is simple, only 2 parameters that we need to choose, only 3 unit parts, very easy to use applicator. It's very elegant. It stands out because of its silhouette, very feminine silhouette as comparison to all the robust medical devices that we have on the market. We have a uniform spread of material. We have very high integration of the material within the tissue. We have a freedom to choose the type of material that we want to choose. We can choose hyaluronic acid. We can choose botulinum toxin. We can use corticosteroids. We can use a lot of material compared to the abundance of the optional indication that we have with the enerjet. We can control the depth of penetration. We can be very, very shallow. We can go quite deep. Again, depends on the treatment that we are offering. And we have an automatic program dosage for each administration. The enerjet has a package of supporting tools. We have all the related clinical documents on the VSP. We have the training materials, user manual, all the clinical publication, before and after, treatment protocol, treatment sheet, informed consent, and photography guidelines. In addition, we have different videos that you can either learn from or distribute to your clients. All marketing videos are also on the VSP. We have the product videos, testimonials, waiting room videos, and application videos for the patients. Thank you very much.